With more on the flu, I'm joined by infectious disease and microbiology expert Dr. Neil Rao. Doctor, thanks for joining us this morning. What kind of flu is this?
Well, the first thing we can say is it's a new virus that has never been seen before. And what is concerning is that even though it has the word swine flu, meaning it originates from pigs, is that people who get this infection have no history of contact with pigs. And I contrast that with all of the bird flu fears that we had over the preceding years, where people had household chickens or backyard chickens in various countries of the developing world and would incidentally come into contact with those animals and then get the virus and an infection, which was quite serious. Here we have a history of no contact with animals, and yet people getting this new flu strain that has an origin from pigs.
So then how is it contracted?
Well, it raises that's the existential question. I think now the answer is getting more and more obvious. It's being spread person to person. The question is just how extensively is it being passed person to person. Given the number of people who are infected, there is definitely some degree of human-to-human transmission, and the World Health Organization experts are now meeting to come up with a decision on which level of pandemic alertness we reach now based on this recent development. And if there is extensive human-to-human transmission, meaning multiple communities are involved, cases are popping up far away from where they originated. Now it seems to be clustered in a few areas of central Mexico and southern Mexico, but more concerningly the capital itself. If we start seeing extensive spread to other places, then of course the pandemic level preparedness will bump up even to a level 5 rather than a level 4, which I would directly anticipate based on this development. As a minimum, it's going to go up from the level 3 that we have now to a level 4.
And level 5 being the highest?
Highest before you call it a pandemic. In other words, it's on the verge of a pandemic. Level 4, the implications are, at least from the Mexico perspective, deploying the use of those antiviral medicines. Tamiflu is the household name that we all knew about. People were hoarding and stockpiling at hospitals, public health units all over the world were hoarding Tamiflu. And there's also a WHO stockpile which needs to be deployed to Mexico. I'm sure it's already being used. People who are exposed to those who have had the infection are being given this medication. But if we reach a level 5, then we're going to be talking about travel-related issues, travel advisories, perhaps even travel bans. And I think that's sort of the waiting and anticipation game here to see which level they reach today. That's going to be a big driver on the travel restrictions. One important point, though, is a lot of Canadians are concerned about a history of travel to Mexico, but keep in mind that Canadians are visiting resort areas, generally speaking, and not the areas that are most affected. And we all remember how the entire country of Canada was circled when Toronto, and a very small part of Toronto, really had SARS. And I don't think we should do the same thing to the Mexicans and tar the entire country with the same brush.
Dr. Rao, we're understanding that the symptoms are similar to other types of flu, so how can people determine whether or not they may be contaminated?
It's very difficult, actually, and that's one of the big challenges even in looking at people who come back from Mexico and deciding if they have swine flu or not. The answer really lies in the lab tests. One hint, though, which is different here in Mexico, is that people who are aged 25 to 44 are unusually affected. So if at a Canadian level we started to see a cluster of young adults coming down with bad pneumonia, that would be an alarm bell, a heralding event, a sentinel event. But otherwise, flu versus even bacterial infection, they all start with the same early protean symptoms. They're actually kind of hard to tell apart. So the problem with giving everyone this health information is that we're going to have a whole bunch of people show up in emergency rooms with a tan on their face saying, I've been to Mexico and I've now got this. And really, it's nothing different from usual. I think once we have documentation of exportation of cases from Mexico, there will be more to be concerned about. But at that stage, we would have a bigger reaction here in terms of the use of antivirus medicines being available and used if we had outbreaks here.
Doctor, I want to get this last question in, but we don't have very much time left. Obviously, this meeting now going on in Geneva. How concerned is the medical community about the situation?
We're very concerned. I mean, this is the closest we have been to being on the verge of a pandemic in the past 5 years. All of the bird flu stuff came and went. It blew over. It was concerning. It was serious, but we never had this degree of human transmission, this degree of geographical spread of a novel virus. So there's no question this is a watershed event, and I can anticipate the level of pandemic alertness is going to go up. It's just a question of how high.
Dr. Rao, we appreciate your time and insights on this. Thank you very much.
My pleasure. Thank you very much.